The Charlie Gard case was a best interests case that focused on the child Charlie Gard in 2017. Now, Charlie Gard had a rare genetic disorder, which was mitochondrial DNA depletion syndrome, which is a rare genetic disorder that causes progressive brain damage, muscle failure, and has no cure, and eventually causes death. The case involved the parents of Charlie Gard taking the NHS trust that was looking after him, Greater Ormond Street Hospital, to court over their decision to withdraw treatment as they believed it was futile. The parents argued that there was an experimental treatment that was being offered by an American doctor, which, as claimed by the American doctor, had a 10% chance of working. Now, we'll go into the details of that and a bit more details around the case in a little bit. But fundamentally, this is a best interests case. Straight off the top of your head, you're thinking about your best interests and non-maleficence, those two pillars of your medical ethics. As well as that, you've also got the idea of consent. So coming back to children and their inability to consent or deny medical treatment, in their lack of capacity, it's then deviated to the parents. But if the parent's decision doesn't align with what the doctors believe to be the patient's best interests, then they have to take that case to court to try and get the court to decide and see if they are in agreement with the medical team. Eventually, the case went all the way up to the High Court, and eventually the High Court were in agreement with the medical team's decision to withdraw treatment and to allow Charlie to pass away, as they agreed that the case was futile and continuing treatment was not in the patient's best interests. The neurologist based in America, Dr. Hirano, offered the experimental treatment to the parents. However, this was done remotely, and the doctor offering that treatment hadn't adequately reviewed all of the patient's notes before making that recommendation. So that was a factor in the court's decision. And so, as we mentioned previously, the ethical considerations here include firstly beneficence. Additionally, we have non-maleficence. You also have issues around autonomy. So while we prioritize patients' ability to decide, again, as we mentioned, Charlie doesn't have the ability to make that decision, so it was deferred to his parents. So lastly, we also have issues around justice. So when this case comes up in interview, there is the potential that you could be asked about just distribution of resources generally and whether this was a fair distribution of resources. So those are the main features of this case and some of the questions that could come up. Again, feel free to go ahead and do some further reading about this case or some of the other cases that you have had in similar examples where there is a difference between the parents of a child's opinion about the way treatment should happen and when it doesn't align with what the medical team believes to be in the patient's best interests. So go and have a read about this, or go and have a quick Google about this. And again, practice getting asked lots of different questions about this case. Frequently does come up in medical interviews, and you should aim to be prepared for it.